Welcome to the Brain Spine Neurosurgical Institute. Our goal at BSNI is fairly simple. We want you to have a thorough understanding of your condition. Patients often leave their doctor's office confused and with many questions. We want you to have an effective knowledge of your diagnosis and your course of treatment, so that together we can work as a team to address your concerns. Today, we are going to discuss the discectomy. Our visit starts with a thorough examination. Patients often present with pain, radiating down from their neck or back out into their arms or legs. This pain is often due to the compression of a nerve. Often, we can identify the source of the pain by looking at an MRI. Let us review what we see in an MRI. The spine is made up of a group of vertebrae, or small bones, stacked one on top of the other. These vertebrae are separated by cartilage, a spongy material that provides cushioning between the bones. In this particular picture, the vertebrae are brown and the cartilage is white. The vertebrae surround and protect the spinal cord, which is seen in yellow in this picture. The spinal cord is made up of a collection of nerves. The spinal cord is surrounded by fluid. This fluid is almost like a protective balloon. In this picture, we see the rapid progression of a herniated disc. The discs of cartilage between the vertebrae are constantly supporting our entire body weight. Over time, this pressure can result in one of these discs being forced out of place and into the spinal canal. As it continues to bulge, this disc may press against a spinal nerve. This compression often results in leg or arm pain. In this MRI, we can see that the patient has a relatively significant disc herniation that is pressing against the spinal column. The procedure is done with the patient lying on his or her stomach. A vertical incision is made at the site of the spinal cord impingement. If the herniated disc is located between the cervical vertebrae, the incision is made around the upper spine, slightly below the neck. If the herniated disc is amidst the lumbar vertebrae, the incision is made in the middle of the spine, much like that seen in this picture. At the site of the incision, retractors are placed to hold the surrounding muscles aside and gain access to the necessary portion of the spinal cord. Next, we address the specific location of the disc herniation. Here, we see a side view of the displaced disc pushing into the spinal canal. With a device very similar to that seen here, we remove the portion of the herniated disc that has obstructed the spinal cord. This process is known as a discectomy. The incision is then closed and the procedure is complete. The procedure will last between 1 and 2 hours depending on the number of discs that require attention. Scarring is minimal as the incision is only between 1 and 2 inches wide. Discectomies are often performed as outpatient procedures and patients will return home the same day. In most cases, patients can expect to be walking shortly after surgery. Hopefully, this will give you a better understanding of a discectomy. The procedure is safe and very effective. If you have any additional questions, please don't hesitate to ask.